So, do you know what this is?
Yes.
Okay. Does everybody else know what the B Award is? Does anybody know what it is?
They should.
Yeah. They should. Keisha and Bridget know. So the B Award is the companion award to the Daisy Award. And it is given to our support staff. So this is our first presentation of this award in the Northeast, and yes. You were nominated by that person standing next to you. So I'm going to read to you what Terry wrote.
That's not that good.
She is prolific. So, Melody is an amazing person who is constantly thinking of ways to improve our unit. Her smile and cute sayings make us laugh every day. Are they clean?
Yeah, they are.
Mel came up with a saying about our laundry. Don't fill it up if you can't pick it up. For our soiled linen bags, to keep the staff from overfilling the dirty linen. Not only does it prevent overstuffed bags, it makes us all smile and do the right thing. Mel is a tremendous asset to our unit, and working with her, you know you're going to have a good day.
Oh, thanks,
Clearly your co-workers know what an invaluable resource you are to them here, so thank you for all you do every day and for making 3D such a great place.
Thank you. Thanks, guys.
Yeah, you deserve it.
You're more winner.
Thank you.
Congrats. Look at all these people.
Here's your pen.
So there's a banner, which is really nice. So this will hang on the unit in honor of you. Here's pretzels for your team from you. And thank Melody for the pretzels for all of you. And
Thank you.
thank you. Bridget, I'll give this to you.
Beautiful.
Yeah.
So, congratulations, Melody.
Thank you.
So you are our very first B Award winner in the Northeast hospitals. What's that feel like?
It was amazing. Really
So-
shocked.
You're shocked?
Yes.
When you saw people coming up this morning, what did you think was going on?
I thought we were celebrating the Daisy Award. So I was so excited. And I was like, oh, wow, who we're celebrating today?
We're celebrating you. And, you know, I think what's great about this award, you're our first B Award winner in the Northeast. And I think what's really great about this award and why I love it so much is, you know, our support staff are an integral part of our nursing team. You know, when we do well because of all of us, like you said. And, you know, our support staff, you know, absolutely deserves to be honored every day and celebrated every day and, you know, feel the gratitude that we all have every day. So I think this award is just a wonderful symbol of just how people feel about our support staff. And the fact that you're our first winner, I think, is perfect. I mean, you,
Yeah.
right, right? And, you know, Keisha doesn't lie. We all know that. So if Keisha's saying it's true, it's true. You know, I think, you know, you have been certainly a model in terms of your role, you know, in terms of working with the whole department and the shared governance group, and you've been on Schwartz rounds. I mean, you've really been sort of the symbol of what a great CNA looks like. So the fact that you won this and, you know, you were nominated by your peers, I think is just, it's perfect. I love that you're so humble. So you saw us coming, you thought it was the Daisy, you know.
Yes, I was so excited.
Are you still excited?
We're so, you know, exciting. I love to see everybody, you know, get celebrated.
So how does it feel for you to be celebrated?
It's amazing. It's amazing. It puts another smile on my face.
Good, good.
But I believe this is a group effort. The hospital is not run by one person. It's run by a group of individuals sticking together. In any kind of weather, as I would say.
In any
So
how long have you been here on 3B? How long have you worked on 3B with this team?
I've been here for about almost 7 years. It'll be 7 years in March.
And where were you before you came to this team?
Before I came here, I was at the Simpson House for 10 years.
For 10 years. And what made you leave? So that's an outpatient.
Yes, it's a nursing home facility.
So you left there to come to work in a hospital. How come?
Yes.
What made you make that change?
Change of scenery. In the nursing home, things are run differently. So far as support, you know, with the nurses.
Okay.
And the nursing, one of my girlfriends used to work here, and she told me what a great hospital this is. And she works in another department, but she introduced me to the manager here at
Nice.
the time.
Nice.
And I love it here because of the teamwork. The nurses and the nurses' aide, we all work together.
Why do you think you guys here are so successful in that? Why do you think you're such a successful team? Because you are, and that's obvious.
Remaining positive. You know, the healthcare field is not easy, but we do it because we love what we do and we love to take care of people.
How have you, so that's amazing, right? Because it's hard, right? Everyone, it's not lost on any of us that this, you know, your job's a hard job. You don't come in here and, you know, have an easy go of it on any given day, and we know that. How are you personally able to kind of maintain that positive attitude, feel good about your work, and feel good about your team every day? How do you do that?
I believe in treating everybody with dignity and respect, no matter the background that they have. And I also believe that nobody really wants to come to the hospital, right? Nobody wants to be sick. But I always told myself, if any day would happen, and unfortunately if I was to get sick, I would want a strong supporting team behind me to treat me with dignity and respect. So while I'm here for my 12 hours, I try to make it a joyful experience as possible. My name means music, so a lot of my patients, they always ask me, "What do you sing?"
That's a terrible question.
And I always say yes after 3 p.m. So when I come in to do their 3 o'clock vital signs, I go into their room after I knock first, and I say, "I'm coming in to do your 3 p.m. vital signs."
That's great.
And so, yes, so it always put a smile on their face, you know. And even though I can't take away their diagnosis that they have, if I can make one person smile, it means the world to me.
Well, you clearly make more than one person smile, and you clearly keep your team smiling. I mean, that's
Thank
to be
you.
nominated by, you know, the team up here, and that was what they said about you, that you're just, you know, just an incredible team member, and that you do help do that here every day. So I think you're probably one of the reasons this is a good place to work, if I had to guess.
Thank you.
If you, so, you know, Keisha's our educator for our support staff, and, you know, she's worked closely with you as well. You know, I would ask both of you guys this question if I could. You know, if you could give one piece of advice to actually, I'm going to ask you two questions. One, if you could give advice to your colleagues, your CNA, your, you know, support staff colleagues about how to be successful in your role, what would you say?
I would say stay positive. Stay positive and be open. Be open and caring.
And always remember, everybody that you work with every day, the energy that you give, it rubs off on everyone around you. So just try and stay positive and happy and get the job done. Because at the end of the day, you just have to take care of your patients, right? Because that's
Yes.
what we come to work for, take care of our patients. So, yes, just you coming into the room, and the nurses were just saying, "Oh, we have Mel. She always makes the day better. No matter how bad it may seem, people always are so happy that you are their aide." And that says a lot about you. So
Thank you.
congratulations.
Thank you.
You are so well deserving of the First B Award.
You
Oh,
really are.
thank you
Yes.
so much.
And I'm going to ask you another question, and I'm going to ask both of you to answer this as well. If you could give it, so there's a lot of new nurses, you know, both of you know that, and particularly now, a lot of the nurses that are coming onto the unit are new to practice, so this is their first nursing job. If you could give them advice on how to be successful as a nurse, just starting out, you know, both of you have a great perspective on that. You've seen a million nurses come through here. What would your one piece of advice be to those nurses when they're just starting out professionally?
Take your time. Take your time. Always be positive. Never listen to negativity and other people's experience. You make your own decisions based on what you do for yourself. And always ask questions. That's how you learn. Even if you're a veteran nurse or a new nurse, every day is a learning experience. Every patient is different. So you learn from each patient.
That's great.
And communicate too.
Mm-hmm.
Talk to, make sure that the new nurses talk to the PCTs. Just ask for help. Don't be afraid to ask for help. We also do a residency group project the new RNs and the PCTs, Mel is a part of it. She's been coming to NI to do it with us, and it's so good. We have to let them know, don't be afraid of your PCT. We're all here to work together as a team, and we have to communicate, because I don't know what you don't know, right?
It's true, and you have to ask. And I think sometimes, especially when people are new, sometimes that's hard, you know, because you feel like you don't want people to know that you don't know when you're brand new. But I think that's really excellent advice. I can actually vividly remember when I was a brand new nurse, which was a long time ago, the people that I learned the most from when I was on the unit were the PCTs that I worked with, without a doubt, hands down. They looked after me. They took, you know, they didn't let me do anything stupid or stupider than I was already doing. And, you know, I just learned so much from them, because you're so, what you guys really do, and I think when you do it well, do it so well, and you, both of you, I think are symbols of this, is you know how to care for people. You know how to be with people, and you know how to care for people when they're not okay, because they're sick or they're feeling some sort of way. And the PCTs that I've certainly worked with, and I know both of you, and I know both of you, you know, exude this. You know, you're expert at that. And I would encourage all the staff to really, like you said, pay attention to that, because they can learn a lot from just watching you and watching how you do it. I don't know that they're going to sing at 3 o'clock, but any final words you have? Anything you want to say?
Thank you, everyone. Thank you, everyone that nominated me. Thank you so much. I really appreciate it. I love what I do. I love to take care of people that sometimes need help and sometimes need help with everything.
Well, we love you,
Thank
and
you.
we appreciate
Love
you,
guys
and we are
too.
incredibly grateful to you for all you do every day. So thank you.
Thank you.
And
Thank
have a
you.
good day.
And have a
Yes,
good day.
thank
Keisha
you.
and I
You
come back
guys
and sing
too.
at 3 o'clock for
Have
you.
a good day, everyone. So, I think it was it Saturday? It was Saturday.
This past.
Either this past Saturday or the week past. We have a group of nursing students that come in from Holy Family. And when I leave my shift, I try to give them like a little speech, and they always start laughing. They always laugh at me. But it's coming from the heart. And I always told them, I said, I'm so proud of you guys, because they graduate in December.
Oh,
I said, I'm so proud of you guys. I said, you guys have already went through the hardest part, you know, of school, and now you guys are almost at the end. I said, as new nurses, I said, always remain positive and know who you are as a person. And look yourself in the mirror and ask yourself, why did I want to become a nurse? When you feel stressed out or you feel like you want to give up, never give up. I said, you always reach out to a mentor, I said, for help.